Hey, I'm David. I'm a fourth year pharmacy student here with Dr. McClendon this month, and we're going to give a presentation on C. diff.
My name is Michael, pharmacy student as well.
And so to get started, we'll start off with first, I've included some resources for patients as well as healthcare workers, and I understand it's hard to see on the slide, but I just wanted to kind of give you an idea of how to the left for the patient resources, it's kind of a roadmap. So if someone's diagnosed with C. diff, they can kind of see where they are on that roadmap and kind of what's coming up next. And then to the right is more focused towards healthcare workers. And that can provide you with just some helpful hints about diagnosing C. diff and then precautions that need to be taken when caring for a patient that's been diagnosed with C. diff. We've provided some objectives here. So by the end of our presentation, we hope that you will be able to define a C. diff infection and common signs and symptoms of infection, then list the ways that C. diff is diagnosed, and then be able to identify the test that's used most. We want you to be able to state some of the medications that increase the risk of developing C. diff, and then be able to identify some treatments that are available for C. diff and kind of when to use those. So just kind of a basic overview of C. diff. Right now, it's been classified into the genus Clostridioides. It was previous Clostridium, but thankfully that allows it to still be C. diff. So that's commonly what it'll be referred to, and that's what we'll refer to it as. C. diff is an anaerobic bacterium, which means it doesn't really need oxygen to breathe. So it's able to grow in places like your gut. And it produces toxins that cause illness, and that's typically associated with stool, so unexplained profound diarrhea. It's most commonly associated with an microbiota imbalance, so that means that maybe the patient takes antibiotics and then it kills whatever they're taking the antibiotics for, but then it also kills the good bacteria that keep everything in check in the stomach, and then that allows the C. diff to grow and grow and grow, which then causes this inflammation and this profound watery diarrhea. You need to have kind of C. diff in the back of your mind when a patient has 3 or more unexplained loose stools in 24 hours, and then that would prompt you to do further testing and examination, which I will talk about some of the testing that's available here. There's 4 main tests that can be used to diagnose C. diff infection, but they're not all typically used. The kind of gold standard diagnosing tool for C. diff is stool culture, which is both sensitive and specific. So if you get a positive stool culture, it's very likely that the patient actually has C. diff infection, not very many false positives or negatives. And the drawback to this is that it takes several days to yield results. So it's not great in practice, because if someone's very sick and you want to give them medication, you have to wait several days to find out if they have this illness, and you're either delaying care or you may be giving care that's not needed. Then for faster results, there's the stool toxin PCR, but this specific test requires special training and a special lab, and it won't distinguish between colonization and infection. So what that means is there are some people that have C. diff growing in their stomach and in their colon, but they do not have the colitis and the diarrhea associated with it. And then there's other people who have infection, which means it's growing, having harmful effects. So it can't distinguish between those. So then there, to kind of better than that, is the stool cytotoxin assay, which has a high detection rate, so both sensitivity and specificity. And the really great thing about stool cytotoxin is that it's fast, so you can usually have results within a day. So for that reason, it's the most used diagnostic testing for C. diff. And then there's also an enzyme immunoassay with different tests. It is moderately sensitive and specific, but it's expensive and it's not as good as some of the other tests, so it's not typically used, but it is still out there. So one thing that is important for healthcare providers to remember is kind of C. diff hygiene. So hands of healthcare workers and then environmental contamination. So think bed sheets, bedpans, bedside commodes. Those sorts of things are how C. diff is transmitted from to person. And it's also thought that these C. diff spores can become alcohol resistant. So it's important when you're working with someone who you suspect has C. diff or is diagnosed with C. diff that you use warm water and soap rather than an alcohol-based hand sanitizer, because the alcohol may not wash off the C. diff spores or kill the active microbe. And then, of course, other things, it could be vectors like sheets, bedpans, and commodes should be washed with chlorine bleach or a different sporicidal agent.
Okay, so David mentioned that the elderly and pediatric population are most affected. So I want to take a minute and look at the risk factors associated with C. diff infections. So C. diff disproportionately affects the elderly adults. Every year over 18, your percentage of risk increases by a small percent. This could be explained by our age-related impairment of the immune system. We don't respond as quickly the older we get. This is more common in the elderly, considering they have longer and more frequent exposures to healthcare settings, which increases their risk. And then they also, with the exposures to healthcare, they most importantly have a higher use of antibiotics, and that's the most important modifiable risk factor for the development of CDI is exposure to antibiotics. So we want to try and keep the duration and exposure of those as minimal as possible. And the highest risk of infection appears to be after the first month after an antibiotic exposure. And then also, cancer chemotherapy is another risk factor, and that is also related to the immunosuppressive nature of the chemotherapeutic agents. So some of the most common antibiotics associated with C. diff infections are your third and fourth generation cephalosporins and fluoroquinolones. These are very commonly used for urinary tract infections and pneumonia. Anybody who goes to an emergency room usually gets ceftriaxone unless they're allergic to it. Your carbapenems are usually reserved for more severe infections, but are still commonly used. And then clindamycin has a wide variety of uses, but it has been one of the most common medications associated with C. diff infections. So now that we talked about the ones that cause it, let's talk about the ones that treat it. Metronidazole was the main option for many, many years for C. diff, but now there are more effective options, which are your vancomycin and fidaxomicin. Metronidazole can still be used in conjunction with either of those two for your recurrent or severe infections of C. diff. And then the transplant they're not very common, but they have been shown to be extremely effective for recurrent infections. So let's take a little closer look at the main treatments. So vancomycin has to be administered orally for C. diff infections. It's not absorbed in the stomach. It actually makes its way all the way into the gut to get to the C. diff infection. And that can be administered with or without food. There's no adjustments needed for kidney or liver impairment. And then most commonly, patients are going to get a little nauseous, have abdominal pain. This could be related to the diarrhea they're experiencing. And then also they will have some imbalances with their potassium, potentially. And then vancomycin can also be administered as a retention enema for patients who have fulminant C. diff with ileus. So fidaxomicin is probably the more preferred option since it's only a twice-a-day administration versus vancomycin that's 4 times a day. And that's administered orally with or without food. It's available in tablets or a suspension. And there's no dose adjustments necessary for that. And nausea and vomiting and abdominal pain are your most common side effects. And then metronidazole should be administered orally with food to minimize stomach upset. It's available in capsules, tablets, and also IV for the severe cases of C. diff. But it does have to be dose adjusted for severe liver impairment. And your most common side effects with that are headache, nausea, and a metallic taste. And patients who are taking metronidazole should not have any alcohol, or they will have severe projectile vomiting, essentially. And here are the references we use and concludes our presentation on C. diff.